I am speaking to you today on behalf of our healthcare professionals, our dedicated doctors, nurses and other vital healthcare workers on the front line. In any ordinary year, we know the pressures that autumn and winter can bring on our hospitals. It doesn't take much imagination to envisage what COVID-19 in all its devastation could bring to our wards. Our efforts here in Newrymourne and Down have been recognised, and thankfully it is showing in our case numbers reducing. Thank you to everyone. However, I'm sorry to say that we cannot afford a moment of complacency. Our healthcare workers are worried, very worried. The Council recently had a meeting with our health trusts. The South Eastern Trust told us they were coming close to capacity due to COVID-19. During the first surge, there were hundreds of empty beds as people stayed away from hospitals if they could. However, there is tremendous pressure on hospital beds as the hospital is dealing with COVID-19 alongside other usual winter pressures. It is so challenging and has taken its toll on many staff who have perhaps had to leave children with other family members to ensure they are kept safe. During the height of the first surge, there were 63 patients, COVID patients in the Southern Trust. There are currently 79 with considerable increased usage of oxygen. Currently, there are also 570 members of staff in the Southern Trust off work due to either having COVID themselves or having to self-isolate due to being a close contact. This is the single biggest challenge as it leads to tired staff having to work even harder. If these numbers were to continue to increase, hard decisions may need to be made over the services staff can actually provide. So let's do what we can to help. It may not sound like much, but every time we keep our distance, wash our hands, wear a face covering where required, or download the Stop COVID NI app, we do make a big difference. Our healthcare workers are wonderfully talented and dedicated professionals who will be there for us if we contract COVID-19. But let's all help them by not calling on their services if we can possibly help it. Thank you for listening.